Have a look inside yourself. Types of psychosis. Hello enlightenment enthusiast, welcome back to Have a Look Inside. Ready to hitch a ride with us? Flash that thumb sign by hitting like and subscribe. In this video we explain what psychosis is, including possible causes and how you can access treatment and support. Includes tips for helping yourself and guidance for friends and family. Hallucinations. Hallucinations could include seeing things that other people don't, for example people's faces, animals or religious figures. Seeing objects that seem to be distorted or move in ways that they usually wouldn't. Experiencing tastes, smells and sensations that have no apparent cause, for example feeling insects crawling on your skin. Hearing voices that other people don't, these could be positive and helpful or hostile and nasty. Delusions. Lots of people have beliefs that many other people don't share. But a delusion is usually a belief that nobody else shares and which other experiences or perceptions show cannot be true. It is natural for delusions to feel completely real to you when you are experiencing them. You might think that you are a very important person. For example, you may believe that you are rich and powerful, or that you can control the stock markets or the weather. These kinds of beliefs are sometimes called delusions of grandeur. Some people find that they can spend a lot of money or take on a lot of debt while they are experiencing psychosis, because their sense of reality has been affected. Some delusions can be very frightening and can make you feel threatened or unsafe. For example, you might feel that something or someone is trying to control, harm or kill you, even when you have no reason to believe this. These ideas are sometimes called paranoid delusions. Hearing voices, paranoia and schizophrenia. Disorganized thinking and speech. Hallucinations and delusions can make your thoughts and emotions feel confused and disorganized, but disorganized thinking, sometimes called formal thought disorder, can also be a specific type of psychosis. Mental health professionals may use the following terms to describe what you are experiencing. Racing thoughts is when your thoughts go through your head very fast. It can involve them racing so fast that they feel out of control. Flight of ideas is where your thoughts move very quickly from idea to idea, making links and seeing meaning between things that other people don't. Many people find that they experience racing thoughts and flight of ideas at the same time. If you have disorganized thinking, you might speak very quickly and stumble over your words so that other people may find it difficult to understand what you're saying. Link words together because of the way they sound rather than what they mean, which can make your speech sound jumbled to other people. This is sometimes called a word salad. Change the topic of conversation very quickly, as your thoughts move from one thing to another. Find it difficult to keep your attention on one thing. Racing ideas flooded my mind. It seemed as though my mind was disintegrating. My inner life, my unconscious mind, started flooding my consciousness without a break. What causes psychosis? The cause of psychosis can be different for everyone, and research into it is happening all the time. Psychosis could be triggered by a number of things, such as physical illness or injury. You may see or hear things if you have a high fever, head injury, or lead or mercury poisoning. If you have Alzheimer's disease or Parkinson's disease, you may also experience hallucinations or delusions. Abuse or trauma. If you have experienced abuse or a traumatic event, you are more likely to experience psychosis. This includes experiences of racism. You may also have racing thoughts and flight of ideas if you experience mania or hypomania. What about recreational drugs? Researchers still aren't sure whether using recreational drugs directly causes psychosis, but you may be more likely to hear or see things as a result of taking certain recreational drugs, like cannabis and LSD. If you have already experienced psychosis, using recreational drugs can make the symptoms worse, in particular if you take high-potency cannabis, skunk, alcohol and smoking. Drinking alcohol and smoking may also stop medication from effectively treating your symptoms, making relapse more likely. How about prescribed medication? You might also experience psychosis as a side effect of some prescribed drugs or while you are coming off psychiatric drugs. Hunger. You may experience hallucinations if you are very hungry, have low blood sugar, or if you are not getting enough food or lack of sleep. You may experience hallucinations if you have a severe lack of sleep or bereavement. If you have recently been bereaved, you may hear them talking to you. You may also feel that they are with you even though you can't see them. Spiritual experiences. Some people experience voices or visions as part of a spiritual experience. This may be a positive experience for you. It may make you feel special or important and help you make sense of your life. It could, however, also be a negative experience. For example, you may feel that you're possessed by an evil spirit. Genetic inheritance. You are more likely to develop psychosis if you have a parent or sibling who has experienced psychosis, but researchers aren't sure why this happens. What treatments are there for psychosis? For many people, there is no quick and simple treatment for psychosis, but with the right support it is possible to manage the symptoms of psychosis and recover. This does not mean that the experience of psychosis will go away entirely. You may find that you still experience symptoms during and after treatment. What treatment can do though is help you learn ways of coping so that your experiences are less distressing and don't interfere with your life as much. What treatments are available? Talking therapies can help you understand your experiences and develop coping strategies to deal with them. You may be offered cognitive behavioral therapy for psychosis, sometimes called CBTP. This is a type of cognitive behavioral therapy, CBT, specifically for people experiencing psychosis. Antipsychotic medication is offered to most people with psychosis as a way of managing symptoms. You may also be offered other drugs, for example antidepressants or mood stabilizers, if you experience mood-based symptoms, as well as additional medication to help reduce the side effects caused by the antipsychotics. Arts therapies can help you express how you are feeling in different ways. They can be helpful if you are having difficulty talking about your experience. Family intervention focuses on helping family members talk to each other about what helps, solve problems and plan for a crisis. Your GP will be able to find out if this is available in your area. What other support can I get? Early intervention. A-teens early intervention. A-teens work with you during your first experience of psychosis. They usually include people who can help you in different ways. For example, psychiatrists, psychologists, community mental health nurses, social workers, support workers. The National Institute for Health and Care Excellence, NICE, recommends that early intervention services should be open to people of all ages. But some places only offer services to people under a certain age, usually under 35. How can friends and family help? It can be really hard to see someone you care about experiencing psychosis. But there are some things you can do to try and help. This video has some suggestions for ways you can support them while also looking after your own well-being, and you listen and try to understand. It can help if your loved one feels able to discuss their feelings and options with someone supportive and calm. Listen to their experiences and ask them what would help. Our information can help you understand more about psychosis and focus on feelings rather than experiences. It's hard to know how to respond when someone sees, hears or believes something that you don't. Instead of confirming or denying their experience, it can help to say something like, I understand that you see things that way, but it's not like that for me. It's usually more helpful to focus on how the person is feeling about what they are experiencing, or maybe offer practical help. Ask them if they would like any practical help. For example, they may like your help to access a particular service or ask you to act as an advocate for them. Well, that's all, folks. So what do you think? Please leave your comments below. Thank you for watching. Have a look inside. Until next time, happy living. Visit megdigital.com.